My name is Michele Schuman. I am a licensed massage therapist and a licensed social worker here with the Integrative Medicine Service at Memorial Sloan Kettering Cancer Center. Thank you, Jonathan. I'm very happy to be here to talk about something that isn't as well researched, which is massage. And there are studies that are being started, and to get it to be evidence-based takes a little bit of time. So I want to start off saying that. I also want to start off acknowledging what that woman was talking about in terms of trying to get what you think you need and not being able to have access to that. It's very frustrating, it's very common. So I want to acknowledge that. Certainly I understand that as being a survivor of cancer myself. I want to just see how many people have had massage here. So you know it feels great. It feels terrific. And something about massage, it's really in the relationship with your therapist on an ongoing basis. If you come once or twice, we're really good about treating something acutely in that moment. But many people come to massage for well-being. And that means, if they can afford it at the outpatient center, let's say, that means that there is a continuum. And things happen in that continuum that you begin to discover things about yourself, and that your notions and questions and feelings about well-being kind of grow and develop. Massage is very helpful for psychosocial variables, I would say. So the New York State Department of Education says massage is the application of a scientific system of activity to the muscular structure of the human body by means of stroking, kneading, tapping, and vibrating with the hands for the purpose of improving muscle tone and circulation. The whole notion of kneading, tapping, and vibrating is very archaic, actually. And certainly massage therapists do much more than that. We don't really need. But it is the manipulation, and good manipulation, the manual manipulation of muscles and other soft tissues. And the goals are to establish and maintain good physical condition and promote health and well-being. And here's a picture of one of our therapists. There's 11 of us at the outpatient center on 74th Street. The rooms at 74th Street, it's quiet, it's well lit, it's comfortable, there's music. So 74th Street, our outpatient center, is very spa-like, but we're still part of the hospital. The history of massage dates back thousands of years when oils and herbs were used to massage away muscle pain. And massage is really one of the earliest forms of pain relief and may be considered one of the earliest forms of medical care. There is just something in that connection between one person to the other of having that skinship relationship, which is extremely healing. References to massage occurs in ancient writings, tomb paintings, sculptures from ancient China, Greece, India, Japan, and Rome. And there's writings about it from China 3,000 years ago. So it's quite an ancient practice. Also at the outpatient massage therapy center, and this is another picture, both men and women, there are both men and women massage therapists. Most people don't care if you're working with a man or a woman. Some people have their preferences, so there are options. Actually, the outpatient center is terrific. Our clinical massage therapy program includes inpatient care. Like today, when I'm done here, I'm going to be working in the hospital, working inpatient. Our inpatient care is free of charge. I know that when somebody is new to inpatient care, when we come, one of their biggest concerns is if insurance is going to cover it. And so one of the things I say right out is that it has nothing to do with insurance. You don't have to worry about it. Our sessions inpatient last about 20 minutes. We've become very popular, so we're not able to do as many follow-ups as we used to do historically. But in that time when we're with the person, a lot of information gets transmitted back and forth, and a lot of their concerns and fears and worries kind of get a little bit stabilized. In the inpatient setting, we'll see people that are in the middle of their transplants, that are in the middle of their chemo, that just come back from radiation, just come back from their test. We see people in the inpatient setting at every level of their medical journey in the hospital. And the confidence we have in working with the people is really based on the fact that we look up their medical records, and we're integrated into the system, and we speak to the nurses and the doctors, and we find out, well, can we touch the person? Or their platelet counts, the clotting factors, do they have any blood clots? I mean, are they, what do we have to look out for? And it's quite a successful program. We also have our outpatient center on 74th Street, and our massage therapy is available inpatient to patients. At outpatient, it's available to everybody, from survivors to family members, faculty. And the referral system for our inpatient is very fluid. It can be done by family members, by doctors, by the nurses, by staff people. We also offer something called monthly touch therapy for caregivers. The whole field of caregiving is now coming under study. I know for myself, I'm a caregiver, not to my husband, but to my sister, and I was to my niece. So there's various levels of caregiving, and it's beginning to be shown that caregiving really creates a lot of stress in the person. And so this class is free. It's the first Thursday of every month. It's given in the hospital. It's about an hour or an hour and a half, and it's open to patients if they can make it. And some people come in with their poles, with their chemo attached, their breathing apparatus, and caregivers, friends, family, however you define caregiving. So again, it's free. It's on the 15th floor. It's for caregivers and patients, mainly caregivers, and it shows you how to massage. Actually, you follow along, massage as a caregiver to your patient, or to, not your patient, but to your family member, your friend. It teaches you how. And in that moment of showing you how to do that, you learn how to maybe give some massage to yourself as well. But it's a teaching tool. You see, integrative medicine is very interesting because we have a lot of teaching tools. We have a website. If you go onto our website, mskcc.org, integrative medicine, you'll see, if you use the computer, that there are many videos that you can view for free on herbs, on meditation, on yoga, on massage, that teaches you how to do these. They're self-help tools. What we're looking at now is one of my colleagues working in the inpatient setting. And this is someone that I would think is 65 plus. May not be, but I think he's 65 plus. And she's wearing protective clothing. We'll go in and do massage if the person is in isolation. We'll wear gloves, masks, gowns. We'll massage them for 20 minutes, no matter what equipment they're attached to. And it's a very helpful program. In 2013, integrative medicine applied 6,365 massages. That's pretty phenomenal. I started in this department in 1999 when the program first began, and I can tell you most of the work we did at that time was a process of education, and to think that we would get to this number is gratifying, to say the least. Inpatients were 2,549, outpatients were 3,816, and a third of this number was 65 plus people, and that's a pretty extraordinary number. And this is for massage. Common complaints that patients report to their massage therapists are anxiety and stress, pain and fatigue, nausea, depression, neuropathy, which is the nerve pain, which oftentimes comes from the type of chemotherapy that you're receiving, movement restrictions, especially if you've had an axillary dissection. I can't lift my arm. If you've had lymph nodes taken out of the groin area, it's difficult to move my leg, and sleep disorders. Many of the people that are in treatment that come for massage come because they can't sleep, or they have interrupted sleep, or they feel fatigued all the time. And most of the people come with anxiety, which makes sense. Symptoms relieved by massage therapy based on clinical studies are pain, that's a biggie, nausea, fatigue, stress, anxiety, and depression. And some of the benefits, and I say some because it's very difficult to wrap your head around everything that massage can do, is it increases relaxation and decreases the stress and the anxiety. It gives a person another way of looking at themselves in the world. It promotes circulation and relieves muscular tension. It nourishes the skin. Oftentimes when I go in inpatient setting, I'll be massaging or want a massage, and they say, please massage my feet and my legs. Their skin is so dry, and they say, oh, I'm so embarrassed, my skin is so dry. But the massage really helps to nourish the skin. It promotes joint flexibility and range of motion. It assists in respiration. Oftentimes when people are in pain or anxious, they don't breathe. Their breath is just into their neck or their shoulders. And the massage helps them breathe again down into their belly, down a few inches below the belly button. So their whole rib cage area, their stomach area, their chest, their shoulders begin to breathe. Massage promotes awareness of the body-mind connection. If your head feels good, your body feels a little better. If your body is not in much pain, your outlook on life improves. So there's really a direct connection between the body and the mind and the spirit, as we'd say. Massage helps with the psychosocial symptoms. And psychosocial has to do with how you see yourself fitting into the world, into your environment. Psychosocial has a lot to do with your quality of life. And oftentimes when people come for massage, they say, I don't feel well, I never feel well, I don't feel pretty anymore, you know, my muscles have melted away, will I ever get my muscles back again? My hair is, you know, will my hair grow back? And the massage helps reintegrate the person. It helps them to remember that they can feel good again in their bodies. It helps you sometimes, you know, you'll touch an arm and you'll say, oh, that feels good. Or they'll touch, you know, another part of the arm and they say, oh, I didn't realize that felt tight or that hurt. It puts you in a much better relationship with yourself, and it also helps you feel, oh, I feel good, I can get out in the world, I can do this, I can be. This is very important components, some of the variables. Also body dysmorphism. My body doesn't look good, I've gotten so thin, or I've gained so much weight being on this protocol. The massage helps you to reintegrate yourself back into yourself. And it also provides a pleasant, caring, and nurturing touch. And we all know how important that is. So some of our considerations are the diagnosis, what the person is diagnosed with. So let's say a person is diagnosed with bone mets in the thoracic and the upper back area. You know you're not going to go near the bones there. What is their diagnosis? What are their medical comorbidities? And that means a person oftentimes, many times here, a person will come, they'll have a cancer diagnosis, but they may also have a heart condition or blood pressure, or they've had multiple surgeries for different broken limbs. So what is that person's medical comorbidities? Who is this person? What is contraindicated? The person may have a fever. The person may have a rash. The person may have just had surgery. What are the contraindications to actually giving a massage? And what about, and I'm talking now, I'm thinking 65 plus. What are the frailties? Oftentimes people will come to us and they're extremely frail. How do they get up on the massage table? How much do you have to help them? I mean, you can't press too hard because you're afraid you may hurt them or create a bone fracture. You have to be very sensitive to the person you're working with. Another one, especially with 65-plussers, of which I'm very close, is age-related changes in vision and hearing. So oftentimes when people come to the outpatient center, there's a glass door. You know, I walk first, so they know I'm walking through a glass door, or the lighting is such, or if I'm speaking to them, to really speak directly to them, to not assume they hear what I'm saying. Another biggie is risk of falls, because many people at the hospital, 65 or not, with all the treatments, there is a great risk of falls. So we're very careful to make sure the person is escorted, that if they get in the inpatient setting, certainly, that if they say, oh, I want to get out of bed, that you're right there so they don't fall down. Also, what's the positioning of the client or the patient for the session? If they've just had surgery, let's say breast surgery, you don't want to put them in prone position or lying on their chest. If they have a lot of tubes on one side, you don't want them to lie on that side. So you're always kind of thinking, you're kind of thinking out of the box, and you're thinking fast, and you're thinking creatively. How do you approach this? Other considerations are psychosocial issues. Oftentimes people will come, and I'm thinking of several women, and they say, I don't want to take off my wig, or I feel very ugly, I want to keep my clothes on. And you really are always working with that. You have to be able to adjust to that. And then what's the therapeutic intent of the treatment? What's your treatment plan? What's your action plan? So I guess what I'm trying to say to you is it's not just a massage. It's a very well thought out, considered approach to working with somebody so that they feel good again. They feel like they're a player. And I have to say here that when I had cancer, there was not an integrative medicine service. And I was very attuned to massage at the time, so I would have massage. But any of the other things, and I was a deep practitioner of meditation. So I had that as something that I could do. But any of the other things, the exercise, some of the mind-body approaches, some of the understanding about herbs, and I was also somebody that had been doing acupuncture for years, that I had to go to all these discrete little locations to get what I needed. I think one of the beauties of integrative medicine is that you can get it in one place, and that saves a lot of energy. In terms of statistics, the number of people 65 and older will double from 35 to 70 million by 230. So us older people are increasing. We're living longer. We need services. We need these services to be reimbursed. And we need these services, period. And I think one of the years ago, I had gone to a lecture by Dr. Cork. It was just when 65 plus was becoming known here. And there was talk of shifting the model, shifting the paradigm to really understand what a 65 plus person really needs medically. And there's been tremendous progress here at Memorial in doing that, from clinical trials to services to a sensitivity on the part of the entire staff as to how to work with somebody who's getting older, who is older. The NIH and the National Centers for Complementary and Alternative Medicine, we don't like that word alternative, we like integrative, in a 210 survey said 50 plus people, 47% reported using CAM in the previous 12 months. That's quite a figure, and that was back in 2010. And then the NIH and the Center for Complementary and Alternative Medicine in 2007 that an estimated 18 million U.S. adults received massage therapy, and that number is vastly bigger. In 2004, Memorial did an evidence-based study here, and it was 1,290 patients, and they recorded their symptom scores for pain, fatigue, stress, nausea, depression, and other problems. And it was found that these numbers would decrease by half. So some people may have recorded before the massage an 8 out of 10 on their pain, and after the massage it went down to 4. Other people might have reported that their pain score was 10, and it went down to 5. The point is that these people reported that their symptoms were decreased by half. And in a subset of 98 patients that were checked 2, 24, and 48 hours after massage, it was found that the relief was sustained. So I think that's a pretty good figure. The massage therapy team, we're all state licensed. Many of us are older. All of us have a lot of experience, and some of the massages we do, and these are just titles because we incorporate so much, is Swedish reflexology, which could be hand reflexology, foot reflexology. One of our therapists also incorporates ear reflexology. We do Reiki, and Reiki is very light touch. We hold our hands over different parts of the person's body, and Reiki is very good for people who have a low platelet count, who are extremely weak, who may not want to be massaged, who may not want to take off their clothing. So this really caters to somebody who may need to take a little step back, and you can facilitate really good work using Reiki. Shiatsu, we even do shiatsu. We do it on the floor sometimes for people who are a little bit hardier. On the futon, we do shiatsu on the table. Like I do shiatsu now on the table because it's a little bit more difficult for me to do it on the floor. We work with people with repetitive stress injuries, carpal tunnel, bursitis, tendinitis, difficulty in movement. We also offer medical Qigong, which is a form of Tai Chi, and really focuses awareness on breath, holding points, and prescriptive exercises. We do manual lymph drainage. We're not lymphedema therapists, that's a special department, but we have therapists who are trained in a very gentle form of massage that helps move the lymph fluid along without doing the wrapping. So if somebody is pre-lymphedema or someone has some swelling and feels they want to move some of the fluid along, we work with that, and very, very strongly with physical therapy in that regard. And we do something called kinesiotaping. And kinesiotaping is using hypoallergenic taping, which is very good for rehabilitation to support structure that may be inflamed or hurts. It's very good for muscles. So sometimes people will have a knee pain or a muscular pain, and they'll be kinesiotaped. And traditionally, it's been felt that it's only used for athletes, but not necessarily. It's also used for people that want to come in and not have a massage, but might need that support without the massage. Does that help you? It's an actual system where you tape different parts of the body, and the tape stays on for about 3 days. And then the next thing that we do is aromatherapy, where we use certain oils and scents, and we mix it in with the creams. And it's very relaxing. For me, who's allergic to perfume, I'm not one of the therapists that gives the aromatherapy, but some people really like it. It's stimulating to the points, and the sense of smell, we remember smells from when we were infants. The sense of smell is very powerful. And if you were ever smokers and didn't have that sense of smell and then stopped smoking, you know the power of smell. So for people who really feel that to be stimulated through the sense of smell is important for them in terms of their healing and well-being, we do aromatherapy.
The only service of everything that we discussed in all of integrative medicine that requires a physician, nurse practitioner, or physician assistant referral is inpatient acupuncture. And that's because obviously acupuncture is the one invasive modality. So we'll want to know if a patient is inpatient going through treatment or after surgery, that a doctor has signed off on it. We know that it's appropriate. Everything else you can self-refer, but if there's any level of doubt or you're not sure, you can come in for one of our consultations and we'll help you, first of all, figure out what questions you should be asking to determine if the therapy is appropriate, but also we'll help you answer those questions. So there are a couple of ways that can be done. One is with a free overview. You can call our main number and schedule a free overview, which is going to tell you about all the services, more specifically about all the services that we offer and what might be best given the symptoms that you're looking to treat. And another one is actually going through our physician consultation service, which is a little more involved. That is actually billed through insurance. So as Dr. Bao said earlier, we have 2 integrative medicine physicians who do consultations at 53rd Street and at the Breast and Imaging Center, and hopefully soon we'll be at the 64th Street outpatient location as well. And you can schedule a consultation with them. There are 2 physicians for all of Memorial, so there's a little bit of a wait right now. But I will say it's worth the wait, and if you call and schedule one of those appointments and you're already registered through Memorial, we'll bill that directly through your insurance. So that is the one service that gets billed directly through insurance.
Yeah, thank you.
What's the phone number for that?
It's the same phone number that's on the back of all the materials, our main number, which is 646-888-0800.
And I just want to add to what Jill's saying. Whenever anything we do, we enter it into the hospital record. So this is an important thing to know. When we work with inpatient massage, it goes right into the hospital system. When we work with outpatient massage, it goes right into the hospital system. So if you are a patient here, the doctor and the nurses and the whole medical staff have access to everything you've done. The time you did it, the results of what you've done, your considerations. So it's integrated into the system. So it's very difficult for something like that, let's say massage, if you did something that was contraindicated, for that to fall through the cracks, because we list everything. Nice to meet you.